Okay, good morning, everybody. Welcome to the meeting today for our staff meeting on Tuesday. Mr. Manager.
Thank you, Chairman. Good morning, Commission. Two items for staff today. First, we'll have a presentation from the Mayflower Clinic, and some folks are here. We'll have Abdul get up first and go through a presentation and have discussion on their services. And then if we have time, we'd like to discuss the ethics policy that we are developing for employees of Sedgwick County if there's time after the Mayflower presentation. So those are the two items for today, sir. So with that, we'll have Abdul.
Okay. Morning, Abdul. Welcome to the meeting.
Good morning, Mr. Meitzer, honorable commissioners. I'm here today to present to you some of the services for mental health that I think Mayflower Clinic can provide the county. First, I'd like to give you a brief history of the Mayflower Clinic, and I brought some brochures as well to pass along at an appropriate time. The clinic was started in...
Hakeem can pass them to us.
Sorry.
Thank you.
So as I was saying, Mr. Meitzner, the clinic was started in 2010, way back at the start of the recession right after aftermath of the global recession in 2009 and 2008, and when thousands of aircraft workers were getting laid off. So this was an effort by the immigrant physicians and the immigrant community to Wichita that had made their home. And they were looking for a platform to volunteer their services to help out the people that had enabled their success. So we've been around over 10 years now, chugging along, seeing an average of about 700 patients pre-COVID. Unfortunately, after COVID, for whatever number of reasons, our patient numbers have dropped a little bit, and we're on our way back up. So one of the things after COVID, we had decided, what are we going to do with this clinic long term? Either we go big or go away. So one of the things we did is I've had the privilege of showing the facility to Jim Howell and Dave Dennis, who've been toured our facility along with Tom, is that what can we do to make a difference and be relevant in the next decade? So the thing that came out to us was, why don't we expand the mental health services? In our audience, I have Dr. Monish Mittal. If you recognize him for a minute, he's the Director of Psychiatric Services at Via Christi Ascension. Under his able leadership, he drafted a plan for us to how to alleviate the mental health needs of uninsured and underserved Wichitans. And that's really the story I'd like to present to you today as to how we can help. I believe Mayflower Clinic is uniquely positioned to help the underserved population in Wichita, in Sedgwick County specifically. And the reason why I say so, because we are open on weekends where there's no other safety clinics are open. In fact, the efforts by the county to alleviate mental health crisis is only open Monday through Friday, and there's nothing available on the weekends. So that is a big value proposition, if you will, that we offer to the community. And along with it, perhaps the biggest value proposition that we can provide at the clinic is to integrate family medicine services as well. Because as you know, it's self-evident that most of these mental health patients also need family practice, your routine chronic conditions like diabetes, hypertension, and things like that. So we were able to provide those because we are already providing this. We are very, very fortunate at Mayflower Clinic that we have the capacity. We just underwent some major remodeling, as Mr. Howell saw and Tom saw, that we spent over $200,000 in remodeling the lower half of our building. And we have the capacity, And most important, we have an incredible team of providers, starting with Dr. Mittal and Mrs. Dr. Mittal is a professor of psychiatry at KU, and she and Dr. Mittal is really the main reason we're here, is because with their able leadership that no other safety net clinic can boast like we can. We have the capacity in not only in terms of skilled personnel, but in physical facilities as well. So today, my ask to you is basically a very small amount of money, $36,000, and that is in short going to provide us a little bit of a boost to launch this program. Along with the brochure that I passed along is a little bit of a budget. It's not much of a budget, but it's a one-year projection of what we intend to do. Our cost, as you can see, is approximately $100,000, and we're asking for about a third of it. And once we have this, we'll start the program almost immediately, and then we'll go out, seek other funding, private donations, maybe other, maybe City of Wichita, maybe State of Kansas, just anywhere and everywhere. We intend to have a full court press to fulfill the shortcoming of the funds to do. And then, and after, please consider this as a pilot program, if you will. So if I'm successful in delivering what I think we're going to deliver, you can be sure, by God, I'll be back here in a due time to ask for more money. But next time I come back, I will be sure to have some facts and figures to prove to you that this money was well worth spent. So with that, I'm open to any questions. And Dr. Mittal is here. Tina, here, she's leading the effort of the clinic, and she's done an incredible amount of research as to how mid-level practitioners, students at Wichita State, students at KU Med Center can come in and provide their volunteer services, because it's a really great win-win situation for them, because they get some clinic hours to help them through their professional requirements and credentialing as well. And then I have Amanda. Amanda is here as well. She basically runs the operations of the clinic, and I basically oversee all these people in their efforts. So I'm open the floor to please ask away any questions you may have.
Okay. Well, thank you. Do you want to ask if Dr. Mattel or Tina or Amanda want to say anything at this time?
Dr. Mittal, please.
Okay.
If you step up here, just.
I think you have covered all of those, but I'm available. I guess a few questions.
How do I pronounce your name? Dr. Mattal?
Mittal, yes.
That's right.
I don't have anything else to add. I think Abdul has covered it all, but I'm available to any questions.
Okay. All right. Thank you. Anybody else? Okay.
I get really nervous talking in front of people, so sorry. My name is Tina. I'm a working mom.
Okay. It's okay.
Starting this program is really going to help a lot of working mothers, especially working mothers who don't have the ability to go see doctors during a 5-day work week when they're trying to raise their kids and work. So it opens it up to working mothers of both English speaking and Spanish speaking as well.
Okay. Thank you, Tina. Okay. It's all right, Tina. You explained nicely. Thank you. Hi, Amanda.
Yeah, I'll go ahead and take this down so you can hear me a little bit better. So yeah, this is something that the clinic has talked about doing for a really long time. I got on with the clinic in January, and as somebody who has dealt with a lot of mental health issues and has gone through that system, you know, it was really exciting for me to be able to offer this service within our very own clinic. And what I think the most important part about this is that ComCare is experiencing a lot of backup. They have a lot of patients coming in, and they just don't have the time and resources for everybody. And so I think the Mayflower Clinic opening this program is a great way to alleviate some of that pressure that ComCare is facing right now. You know, as Tina said, being open on the weekends is critical because mental health does not rest on Saturdays and Sundays, unfortunately. So, having access to things like the CommCare crisis line, and, having a little bit of leadership from them as well, I think would make this all the more effective. Yeah, that's really all we have to say. Any questions, we'd be really happy to answer.
Okay. Commissioner Dennis.
Thank you, Mr. Chairman. Let me make sure I understand exactly what the request is. You're looking at a one-year project, correct? And during that 1 year, you're able to work from Wednesday through Sunday, so you are covering weekends from 12 p.m. to 5 p.m. Okay. And during that
Yes.
1 year period, if you have a patient that needs follow-up care, you're available to give that follow-up care. They're not going to move over into our CommCare in order to be able to add to our CommCare load.
Absolutely. Let me clarify a little bit more. Dr. Mittal has set out a policies and procedures for the typical patient we intend to see. We want to make sure we see patients that don't fall back in it. So we've had a good screening process. We would like to stay away from patients that have some violence in their background or some addiction issues, so that we don't crash before we get started. And we want to make sure we start slow and easy and then work our way up to a little bit more difficult and challenging type of patients.
Very good. Well, thank you. Our folks over in CommCare, the last briefing I got was we're about 200 people short on staffing over there.
Wow.
And for $36,000 for a year, for you being working from Wednesday through Sunday from 12 to 5 p.m., I think that's a win-win situation for us, and I sincerely support it. Thank you.
Thank you, Mr. Dennis.
Commissioner Howell.
Thank you, Mr. Chairman. Just looking at the paper that you handed out, talks about patient assessments and encounters. Is that 1,000 patients? Is that what that says?
1,040.
1,040 patients is the anticipation?
Kind of what the anticipation is, yes.
Okay, so that'd be that's what we expect probably for the year. That's just an estimate.
It's an estimate, yes.
Okay. And then,
Does that say hours or people?
I think,
Patients?
I think
well, that's what I'm wondering.
it says hours.
I'm sorry, it's ours.
Is it hours? Okay.
It's hours.
Hours, okay.
Do we have an estimate how many patients would be able to be serviced through this?
Mr. Howell, our initial goal is 10 per week.
Okay.
10 per week, and then we'll slowly ramp it up to maybe 20 per week.
Okay, that's a good answer. Thank you. And Dr. Mittal, I understand you also provide services at Via Christi, or I should say,
Yes, I do.
at St. Joseph Hospital. You're one of their staff doctors over there, deals with mental health
Yes.
issues over there.
Yes.
That's good to know that. So you have that background. Are you relevant to their organization? Have you been there a long time? What's your experience?
I've been there for, I believe, 7 years. I lead their behavioral health service line.
Okay. To me, that's a critical to note that you're in support of this as well. One of the things I love about this type of project here is this is a public-private partnership, and I think that we're lacking in Sedgwick County with mental health services. I think everyone would say that. I think we've been talking about this for years. But I think that if there's public-private partnerships that provide some leveraging, if you will, of these dollars, we're not paying for the whole program. You made that very clear. We're paying for a portion of this program, and the rest of this support comes from the private sector. In fact, I think when I talked with you earlier, Abdul, I believe you talked about there's donated care as well. Absolutely. So a lot of the care that's being provided in this is donated by the community, similar to maybe our dental program at the health department, if you want to think of it that way. And then the other thing is we're going to have performance measures at the end of the year. We know what we got for the investment. We will have data to show how the dollars impacted this community with performance measures.
Of course, because what you cannot measure is what you cannot provide anything without some sort of a measurement. And we're very keen on providing those metrics that support our contentions and support our projections. And that's the only way that we've been able to move forward, and we've written some grants as well, and all of those grants absolutely require some sort of performance metrics to measure the impact of the dollars.
So, getting down to the details here, I understand I see there's therapists on the list here. So there's some therapists who are doing counseling, I assume. If they need some type of medicine, is there able to be prescription through this clinic?
Yes. See, state of Kansas has a program. I hate to use the word recycle, but it's sort of a recycle. So they have unused medicines that they go to a central location and they repackage them and make sure they're still viable, and then repack it and send them back. So we have to write a prescription, and the central repository of where this place is, they then send the medicine to the clinic, and then we give it to the patient.
All right, that's a good answer. Thank you. Then I guess I'll just say this, we're looking at a pretty large investment for the community. I'm not on the Mental Health Coalition. I don't know exactly all the plans there, but I do know there's a planned investment of something more than $15 million in our CIP budget coming up. There's been a lot of discussion, and there's a large commitment, I think, on this part of the community to provide some mental health services. But this will be more immediate. First of all, be more immediate, and I think that the public-private partnerships, where we leverage tax dollars against donations and private investment, is a good model that would actually supplement, if you will, and possibly replace some of the enormous need that I think this community has. It would help provide a more timely solution. Any comments on that?
To mental health, we're a relative newcomer to the game because last 10 years we have focused only on primary medical care. So now with our new paradigm post-COVID, especially in the largest segment of Sedgwick County population, the Hispanic community, we intend to do a very hard push towards figuring out how to reach these communities that are traditionally very underserved. So you can be sure I'll be very engaged. Our whole staff will be engaged as these discussions in the county take place. We plan to attend the meetings and basically learn as much as we can. It's kind of like drinking from a fire hose. So we're up to speed. We're ready to do what it takes.
So again, the facility, thank you for the answer. The facility that I did tour is down in the heart of downtown Wichita, and I guess I just want to ask it. There is a homeless population down in downtown Wichita. We know that. And how do people access these services if they feel like they need help? How do you find the folks that you're going to provide services to?
Yeah, well, first off, we have a very vigorous Facebook presence that we advertise, and then we have a partnership with other nonprofits, churches, if you will, other nonprofit organizations where we regularly meet and pass out flyers to encourage people to come for our services. We intend to use the same channels. We have a meeting with Wichita Hispanic Chamber of Commerce real soon, so they're also reviewing our program to push it out to the community, and especially among Hispanic churches. We intend to do a big outreach. So part of the budget calls for some printing materials and having a marketing person go out there and really push our program.
All right, thank you for the answers to my questions. Thank you. Okay.
Chairman. Would it be appropriate? I see Joan and Tim in the audience. Do you have any comments about this proposal to fill in some gaps? Thanks, Tim. Not want to put you on the spot. I just thought we'd like to hear.
Tim Cockman, Deputy County Manager.
Thank you.
As with Mayflower Clinic, from a public health perspective, we appreciate any time there's a provider that serves the uninsured. And so the work that Mayflower is doing on the physical health side, I think, is good. It's very similar to what we're seeing from other community clinics across the community. We haven't had the opportunity or the resources to fund them, and so this is a different model where we would fund one of the safety net clinics in that way. But again, we value services to the uninsured and the underinsured. We do have, there's a misperception that we don't offer services on the weekend. We have a community crisis center that's available 24 hours a day, 7 days a week. And we've got a psychiatrist that's contracted with us on call over the weekends as well. So I want to make sure that the community understands that this wouldn't replace the community crisis center. We're available for anyone 7 days a week. But again, we partner with people, a number of people all across the community for services. And so this service is an intriguing idea, and we'd be happy to work with it.
Okay. Is there, Mike, and Tom, would there be a reason that, would we have to ask for proposals from, I don't even know if there's other mental health clinics in town that would be interested in a similar, does this have to be a bid, or is this just a proposal that we can consider?
I don't think we would, sir, because of the amount asked for. We would look at funding options if the
pilot.
commission wants to move forward with this. So.
Okay. All right. Thank you. Is there any other questions from the commission? Okay. I don't know. Commissioner Lopez.
Thank you. So I apologize because I have not been given hardly any information up until this morning. I thought we were still going for a $9,000 ask, so this is all pretty new. What services exactly will you provide to 10 patients a week?
As I listed out in the brochure, I think the ones that are listed out in the brochure here, treatment for anxiety, depression, and just routine mental health services. Obviously, I'm not a mental health expert, so I would defer to Dr. Mittal and perhaps Tina to answer that question a little bit better.
I think most of the patients that we're going to look to treat are going to be the patients that have high anxiety, that are in crisis at the moment, who are trying to find a place that can help them immediately, as opposed to having to go to a crisis hotline that you just talk to somebody on the phone. Sometimes that person-to-person contact, being able to just talk to somebody, can help a person out tremendously, whether they get medicine for it or not. Kind of like counseling sessions. So we can also do counseling for anxiety, depression, overwhelmed feelings. If they have suicide thoughts, I think we would definitely probably make sure we assess that, talk to the doctor, send them to the appropriate hospital if that's where they need to know, or where they need to go to get help for the additional crisis that they're in.
So it would be therapy, pretty much. That's
Counseling.
what. Can you guys answer what all we provide at the crisis, like during crisis at our centers with ComCare?
Yeah, Joan Tammany, Executive Director of ComCare. We provide a slew of services through our crisis center. So it could be screening and referral. It could be supportive counseling. It could be a medication appointment. It could be screening for state hospital, referral to community resources. It's just, we do a lot of liaison services with corrections and other places through our crisis center.
And that's 7 days a week?
Mm-hmm.
Okay. Sorry, I'm trying to gather my thoughts here because I'm just trying to figure all this out since I'm just hearing.
Can I just make another clarification statement too, because I don't want a misperception out there in the community. Tim spoke about crisis services being 24 hours, 7 days a week. The accuracy of the 200 employees, vacancies, it's not on our medication management team, so I just want to make sure that that's clear. That's our counseling and case management staff.
And so, to that point, it was brought up that, with ComCare, there are limited resources. Would this take away resources from ComCare that are needed and that we are limited on? Is that going to hurt what we provide now?
I don't think it'll impact us because Dr. Abdul said that Dr. Mittal created a decision tree of who will be served, and it's persons who aren't using substances, people who have no aggressive history. That's not the typical person that comes to ComCare.
Okay. What's the wait time? So if someone wants to be seen, they just show up. Will someone always be there Wednesday through Sunday, 12 to 5? There'll always be someone there ready, like a licensed person?
Someone will be there for sure to answer the phones. I'm not sure what level of license they will have, but we're certainly working on it, but Dr. Mittal is always available by phone or text, and plus we have our regular medical director who's also very well qualified to assess these patients. We also have two nurses on staff, so there's always someone available between 12 and 5 to answer the phones and see if there's needed.
And have you requested money, I mean, you said the state and other areas, have you requested money from anywhere else? Have you received any money from anywhere else yet, or is it just?
No, for this mental health program specifically, no. This is our starting point.
Okay.
Okay, any other questions? No.
You can go ahead and.
Yeah, I do.
Commissioner Cruz?
Who all is on your staff?
Tina, Amanda, and Dr. Mittal, Dr. Kibar, Miss Mary, Courtney, Macaulay. Amanda and Tina and Courtney are the paid staff. The rest of them are volunteers.
And who does your outreach?
Amanda does.
And who does your fundraising?
Mostly it's myself. And we have some other volunteers, board members who go out and in the community hold private fundraisers.
The conversation, Commissioner Howell actually brought this up in May when we had a conversation around ComCare. Commissioner Howell asked Joan Tammany about Mayflower Clinic, and she made a comment about not wanting to talk about Mayflower because of the political nature in which this falls. Do you know why she would have said that?
Maybe you'd have to ask her. I'm not privy to it.
Okay, Joan, can you please address this?
I believe the context of my response to that was because we were discussing budget issues for ComCare or some, I can't remember the meeting context, but it wasn't relevant to the conversation we were having at that time.
Okay.
But I will clarify that when we were given information regarding Mayflower, the proposal had a lot of heavy lift for ComCare to take care of, make sure the referrals occurred, all of that stuff. But I remember the conversation, and it was irrelevant to something else.
So why would that be political?
Because it was brought up out of context, and it was an issue that had just been surfacing around the person who was making the initial ask, and that was really uncomfortable, and it felt like it was being driven for reasons other than altruistic means.
And I don't mean to put you on the spot, but who was the person who brought this to us?
I believe I heard that, the communication I had, it was former Commissioner O'Donnell.
So that kind of clouds this, in my opinion. I have to say that, for me, there is enough to go around with mental health services. And so if you are going to be fulfilling a gap, that's one thing. But the initial summary, and please, Tim and Joan, help me understand how it's changed since the initial summary. There's a couple of things in here that talks about the initial summary that was sent out by Tim. Looks like talks about at this time there is no evidence that this is needed, and it does not create any efficiencies for ComCare providers or patients. The assessment done by our team talks about a recommendation for funding does not seem to be justified at this time. However, Mayflower Clinic may be able to apply for ARPA funds to expand their services, and we could extend an invite to one of those focus groups for their input. Have you guys discussed ARPA funds for this project?
No, ma'am, we have not. The document that you're referring to is the first time I've been made aware of. I never had that privy to that document.
Okay.
Yeah, this just gets a little tricky with those who are involved. It seems a little disingenuous considering that we've, the person proposing it originally does not have the best history. And it kind of seems like someone knows how to work a system. And so that's what he's doing. And it kind of pains me that you wouldn't mention that he is working on this with you. He's
If
not
I
working
may.
on this at all?
If I may. So Michael O'Donnell is our executive director. Michael O'Donnell's purpose, however, in our clinic is solely fundraising. Michael is not here with us today because he does not have any kind of participation in this project. Michael is solely administrative. He has no push, pull, or say in the decisions of the clinic or the programs of the clinic, which is why he is not here. We did not bring him up and we did not bring him here because we thought that may introduce some kind of conflict because of his past. But I do want to reiterate that this was not his idea. This was not anybody working the system. This truly is just our passion, our collective passion for mental health and wanting to alleviate the pressure that is on ComCare. Because medication, whether it's medication or counseling, there is a need there. They are understaffed. There is a need for mental health in Wichita, Kansas, and in Sedgwick County. And that is truly all that we are trying to do.
I do find it troubling, though, that he wasn't mentioned when I asked about staff. Is there a reason why you didn't mention his name?
He's not part of the staff of the mental health effort, period. He has a role to play, which is fundraising. So if you ask me specifically, I find it a little bit disingenuous on your part, knowing fully well the answer you're referring to.
Well, you're asking for funds from the county.
Yes, I am, Ms. Cruz, and I'm answering the best way I can. So Michael O'Donnell is an unnecessary distraction to the process. The real client is the working men and women of Wichita. The system is terribly congested, and we're finding ways to help alleviate the stress. As you know fully well, Mark Bennett and Jeff Easter personally told me that the largest mental health system is Sedgwick County Jail in the state of Kansas. I feel like your questioning is unnecessarily distracting to the effort we have here. And I would appreciate if you stay on the focus of how I can help the working men and women of Wichita, please.
I think it's 100% relevant. So I guess
Okay.
we can disagree on that.
I appreciate your opinion, Ms. Cruz, and I will take what you say under advisement.
Sure. So have you guys been open from 12 to noon on weekends this whole time?
No, we have not. It's the start of the process. When we get this funding, we'll have funds to hire a person to be there 12 to 5. That's in our budget that I sent to you.
Well, thank you for being here today.
Thank you, Ms. Cruz. Thank you for the opportunity.
Commissioner Lopez, did you have anything, something else?
I do. So bringing up ARPA, I don't know who would be the best person to talk about this because there will be mental health buckets, right, that people can apply, and we'll have a team of navigators who can potentially help exactly something like this because that's what that's for. Is that correct? To kind of start something new and see if it would, or I mean, that's kind of the intent that I am under the impression of anyway.
So with our direct allocation, we are able to use those ARPA funds to do additional mental health services. The crux of the issue, because this just came up in the last week or two, is that the way our direct allocation is listed, basically we have to be able to tie the specific service to COVID. Either there's a financial impact that was had because of COVID, and so you can't afford services, or you have some kind of maybe an anxiety issue or something that came about because you had COVID itself. There are, though, many other buckets of funding out there through ARPA that I know we've talked about before, and so the goal would be to make sure that those resources, when they're out there, to connect them through that Community Navigator program, and potentially to go after some of those grants ourselves for ComCare.
Okay, thank you.
Uh-huh.
I'm going to just be perfectly honest with why I'm hesitant on this, because the proposal we originally got a while back is not what you're asking for today. And what we had looked at before, our staff had gone over and reviewed and determined that it was not something that the county should budget for at this time. And we have a list of reasons why, and we could give you that list. Now, if the proposal is different today than it was when we received this, then I think that would be an opportunity to go back and revisit some of that and see if any of that would change. I also think it's really hard for me to sit up here and really start having this conversation, because when it was brought to us, it was very specifically not brought to myself or Commissioner Cruz. So this conversation was had with 3 of the commissioners, with our manager, but it was not brought to us. And there were phone calls made to friends of mine asking that I stop sabotaging a plan that I hadn't even been made aware of fully yet. And so I think it is important that some of that is said, because this is a lot of money that's being asked for today. And there are a lot of people that are asking for money like this too that we're not giving it to. And so I really feel like we should be leaning into what our staff is recommending. At the time that we received the recommendations, it was to not fund this project. And I mean, I just want to be perfectly honest with you. And again, I can send you the reason why the reasonings why they decided that was the answer they gave. But again, if this is something that's changed since then I mean, we could look over that again, because part of the reason there was an issue with it was because originally you guys would take some, however many patients, and then in 3 months we would end up having to get them back. So we could do the checkups and the refills and everything else. If that's different, then that's something that we should be looking into. And then we can see if that makes the most sense at that point. I mean, $36,000 is not what I was expecting to hear today. I thought that we were still talking about a $9,000 ask. So I guess I'm just not comfortable going forward with something when I really don't even know exactly what we're going to be getting, what the return on that would be, and if that would take resources away from ComCare, because as you guys have mentioned, I mean, ComCare is limited on resources right now, and we do provide those critical services on the weekends. And so I do think it's important that we are doing everything we can to not impact ComCare in a negative way. There are other clinics that provide behavioral health services, and so I do think if we're going to look at investing this much money to make sure that this is going to be the right fit and it's going to have the biggest impact, because you're right, there are so many needs in this community, and if we are going to invest $36,000, almost $40,000 as a trial program, I want to make sure that we're going to get the best bang for our buck here for our community, because this is taxpayer money, and I think it's important that we remember that. And I am very capable of separating my feelings about someone and doing what's right for this community. But when we talk about who's involved with this project, I mean, Abdul, it was you and Michael who came and asked for the money. So I do think it's to leave that off and make it seem like it's completely irrelevant. I don't necessarily think it is, because that's how the ask was made. Now, if we could see the new proposal and our staff thinks that that's the right way to go, and that it will have an impact on this community in the right way, and that it doesn't take those services from ComCare, I would be supportive of this. But as of now, I just can't get behind it, because we haven't seen the newest, what you're wanting to do exactly with the $36,000, and then have our staff really have the time to look over that. But I think we could, if you guys would be willing to work with us on that, then I think we could bring this back around and we could have this conversation again. And just to be perfectly honest as well, I think it would be really helpful for us to know exactly how the money that we give is going to be spent, just because of who's involved. And I hate that that's the way it is, but just to make sure that our community feels like their money is being put to the right thing. That's one reason why I really like the idea of ARPA, because it's the federal dollars, and there are more ways that you have to document everything and process on where that's going. And like Lindsay said, we're going to have a team of navigators here to really help find those funds. And so if that's something that maybe ComCare determines isn't right for the county to do at the moment for that large of an ask, then how can we help with navigation and really helping get some of that funding from ARPA so you guys can still do this program and see if it does have, the impact that I know you're hoping it will. So that's where I'm at with this. If we could take some time and let our staff look at the new proposal and dig into that a little deeper, and they, like I said, determine that it's the right way to go, I will be more than supportive of it. As of right now, we have a pretty sizable list of why they're not supportive, but this was also not the proposal that you guys brought to us today, if I'm understanding correctly. Is that right, Tim and Joan? Okay, thank you.
Commissioner Dennis?
Thank you, Mr. Chairman. I think we're being a little disingenuous with all of our comments today. If Michael O'Donnell wasn't involved in this in any way, shape, or form, we wouldn't even be having this discussion. It would have breezed by, because our number one issue that we tout constantly is behavioral health. We say it over and over and over again. We have an option here for $36,000. Last week we sat in here talking about, how about us giving $100,000 to KPTS to name a room? Did that fix mental health? No. Last week we talked about giving $450,000 to TCAM. Did that fix mental health? No. We're going to sit down and we're going to discuss giving another $150,000 on top of $400,000 that we give the GWP for something that we don't really understand yet what we're doing. Does that help mental health? No. We're 200 people short. I don't care what happens. We're looking at an option here to have some assistance for behavioral health, our number one issue. And why are we arguing about this today for now 45 minutes? Because one person is involved in it that two people don't like. So I think that we're being very disingenuous. Thank you.
Commissioner Lopez?
I would just like to make a comment to that statement, because as I just stated, if our staff comes back and says that this is an appropriate thing to do, I don't care who's behind it, then I will follow that. I mean, since I've been here, I feel like I have heard repeatedly how we really have to listen to our staff. And because, the five of us can't know everything about everything. That's just impossible. It's not realistic. And so when I've heard over and over how we need to lean into our staff and really hear their guidance and follow that, it's hard for me when I'm trying to do that, and now I'm being told that we shouldn't be doing that. So I'm not really sure which way it goes here, but I can let my personal feelings for individuals not clout my judgment calls when it comes to doing what's best for this community.
Well, can I address that? I have not heard any problems whatsoever addressed from any of the other funding sources that I just talked about. And this is more important than any one of those.
How many times have we turned down asks for money this year? Tom, do you know? I know a handful that we haven't.
Yeah, several.
Okay, so normally they don't come up here because we've just, we said we weren't able to fund that at this time, so it doesn't come up to public discussion. Is that how? Is that right?
Yes.
Okay, so we haven't funded everything we're asked for. And I agree that mental health is the number one thing we should be working on. So if we're going to invest this money, we should make sure that we're going to get the most bang out of that money, right? Like, how can we ensure that this $36,000 is going to do as much good as possible and doesn't take it away from ComCare? I'm not saying we shouldn't do this, but I am saying that this proposal is different than what we've looked at before, and I think it would be the right decision to slow down, because we aren't talking about our own personal money. We're talking about taxpayer money, and saying that we can look at this again, make that determination through staff, through the professionals in this field, and not us, because we aren't the professionals in this field. So I am not comfortable with it today, but that doesn't mean I could not be comfortable with it in 2 weeks after it's gone over and looked at again. So I don't want this to be because people don't like people in their personal lives, that now that hinders us from making the right decisions for this community, because I think that's completely inaccurate. And I would love to be able to support this once I know that our staff has said that that's the way that we should be going, and that it doesn't hurt ComCare, and that it is the best opportunity for this money, because we have turned down a lot of offers that have come in regards to all kinds of stuff that we've just not said yes to. So I do think it's important to slow this down and to take our time and make sure we're making the right decisions going forward. And if this is not determined at this time from our staff that this is the right path, I would love to be able to help you guys with a navigator to go through the federal dollars and get the money and still have you see that success. Even though it's not coming out of our budget, we can still help see that you get that money in another way. So I just want to be very clear that I am a professional and I'm very capable of separating my feelings for anybody and doing what's right. And Abdul, we've had that conversation. I mean, beyond this, like when you emailed me, I said the same thing that I said then, and I'll stick with that today.
With due respect, I specifically come asked to meet with you, invited you to the clinic, and I did not get a response from you. I just got a general bureaucratic non-answer from you. Basically, it said, we're going to do this, we're going to do that. But I asked for an opportunity to come visit you personally. The staff has visited at least 3 times. I wasted Dr. Mittal's time to come to the clinic to explain to the staff what we're doing. So it's a little bit disingenuous on your part to say that the staff had not had time to review. The document Ms. Lacey referred to is the first time I saw that document. I had no opportunity to refute or rebut anything that in that document. Perhaps there's some miscommunication between you and us or the staff, but as Commissioner Dennis said, $36,000 is a rounding error, okay? It's not a lot of money for the county. $100,000 for naming rights for capers is a lot of money. So with that, I rest my case, and I think we can go on for hours discussing how you're able to separate your personal feelings. I respect that, and I think that's something very honest from you, and I appreciate that.
So I would just say that $36,000 might not be a ton of money to you, but it is a lot of money, and that is taxpayer money that we're discussing here. So $36,000 is a lot of money, and we've turned down a lot of offers that are less than that. And yes, you did email me one time, and I responded, and I said, look, you know, I get where you're at. The staff is going to review your proposal. I am not comfortable making any decision until I heard what their review was, and their review was that they did not think it was appropriate at this time. That's what I told you then, and that's what I'm saying now. But the proposal that they were looking at was not exactly what we're looking at today, because that was a $9,000 proposal for a 3-month trial and not a $36,000 for a year. And so my thing that I'm going to say today is the exact same thing I said in that email. I apologize if you didn't like my answer then, but it's the same today. We need to know what our staff is going to say about this, the people who are in this environment day in and day out, who can tell us if this is going to be helpful for ComCare or not. I am not comfortable making that decision because I am not in the trenches with them every day to know what's happening here today and what exactly it is we need. Now, if they determine that this is needed, then I will be on board with that. But I do not think it's appropriate to give money out when we are not for sure that that's what we need. And I don't think it's appropriate unless the professionals that live in this world are telling us that that's the right way to go. Because again, this isn't our background. This is not where we are going to be the experts here, and that's why we have so many great staff that we can lean into their guidance, and that's what I'm trying to do here. And so I am not saying no, but I am saying I would like to have this looked into a little bit more, and then we can go from there.
I appreciate your answers.
Commissioner Cruz?
Thank you. I mean, it's no surprise that Mr. O'Donnell and I have had issues, but at the end of the day, I want to know who's involved in this, because as Commissioner Lopez has stated, this is a lot of money. I am the biggest proponent of mental health. If this is going to solve a need and fulfill a gap in our community, let's figure it out. Let's fund it. But when I ask you who's involved in this, and you don't tell me, and then your colleague 2 people down tells me, why are you hiding that? That to me seems not very transparent, which if you're not transparent in this public meeting, how are you going to be transparent behind closed doors and when you're not in front of a camera? That's my question, and that's my comment.
I would just like to address, so when he did answer the question, who would be involved, I think the context in mind was more so who directly is going to be participating in this program and overseeing and administering this aid. And that's why Michael was not involved, because even on our primary care level, Michael is not involved. Again, he is primarily a fundraising source, and that is why he was one of the first people to come to you
I
guys.
asked him specifically who was his fundraiser, and he didn't mention it. I mean, we can go and review that tape if you'd like.
No, I do remember him. I do remember him saying that. But again, the reason why Michael was one of the first people to reach out to you guys was because he is such a big contact for us. Everybody in the city knows him. Therefore, he is more aware of opportunities like this than we are, which is why we were not the first people to come to you. Otherwise, we would have been. Again, as I said before, Michael wasn't brought up initially because we knew that, it would create this conversation, which is a conversation we frankly didn't want to have. It's not a matter necessarily of transparency for us. It's more so, like we said, we didn't want a conflict unnecessarily being brought up in this meeting today. Because again, our goal here is truly to mitigate that need for mental health services, which there is one. As they said, from, your staff here, they are behind on counseling staff, and they don't think that this will impact CommCare. So if this is something you guys need to review, by all means, we encourage that because we want to be as helpful to the county as we possibly can. But again, Michael does not have involvement when it comes to our primary care or mental health services. It's like, it's just, we didn't want to bring that into this environment. We wanted to focus on what it was we were trying to do and how it was we could help you guys.
Well, with all due respect, when someone has been charged by the federal government for crimes, handling money, and you come and ask the government for money, he comes and asks the government for money, there is a red flag that goes up with me.
And there absolutely should be, ma'am.
So disclose that when you're asked about it.
Well, of course, but you
'Cause
guys...
it wasn't disclosed.
But you guys were aware that he was involved. That has been disclosed. We didn't talk about it today, again, because, and that may have been a mistake on our part, apparently, but we didn't mention it because he has no involvement on this level. And so, we didn't want to have this unnecessary conversation and take away from our true goal here.
This is a necessary part of this conversation.
And if you look at our budget,
comments.
well, if you look at our budget too, Michael O'Donnell's name is not anywhere on there. So when it comes to his past, and when it comes to you guys funding a project for us, it's not like Michael O'Donnell sees a penny of that. So again, it's not something that I find necessary to discuss.
Well, as someone who's going to vote on this, I do.
And by all means.
Okay. Commissioner Howell?
Thank you, Mr. Chairman. Just to comment, and I have some questions, but I think all commissioners knew that Michael O'Donnell was involved in this from the very beginning. I don't know that that's a relevant point. The point, I think, is that there's a mental health clinic that's coming to us asking for some help to get on its feet. I believe that they will be accountable to us. To me, the most compelling evidence this morning that I think really compels me to want to do something is Dr. Mattel here, who has experience at St. Joe Hospital, providing mental health services to this community. That is a tremendous reference point. To the point whether this is a lot of money or not, I think every dollar is a lot of money. I don't want to waste any taxpayer money, but we do have a enormous problem in Sedgwick County with mental health. And I don't know what the easy answer is, but we're invested in numerous strategies, one of which is ICT-1. And again, let me be clear, I support ICT-1. I want to make it more efficient and more effective. I'm not against the idea of mobile mental health. In fact, I talked with the chief of police of the city of Derby years and years ago, before ICT-1 was even proposed, and we talked about mobile mental health and how important that would be to the city of Derby. Unfortunately, they've not been able to tap that resource very much because they don't really have the information to do that. And that was one of the things that the cabinet board brought forward. They brought 8 recommendations for ICT-1, which have essentially been ignored by county government. The reality is that program costs us roughly $300,000 per team, and you say, no, it's not. Yes, it is. And you add in the vehicle and the fuel and the benefits and the all the costs associated with an ICT-1 team, it's about $300,000 per team. And on their own data, they essentially do a treat in place, roughly one patient per week. One patient per day, 4 days a week. If you divide that up, that's over $5,000, $5,500 per patient to treat in place per shift. That's 30 man hours per person assisted treat in place. Again, I'm not against the program. I think it should be more efficient, more effective. If you divide that out, that's about 6.24 patients that they may or may not help with $36,000. And I think Dr. Mattel and the proposal this morning is talking about helping 10 per week, ramping up to 20 per week. I think that's a pretty good deal. That's just the data, guys. I'm sorry, but that to me makes more sense. I'm not against ICT-1, but I do think this proposal has merit. I'm not going to be distracted by the people who are fundraising behind the scenes. I don't know that matters today. What matters to me is we get effective mental health in the community, especially downtown. And for those of us that champion the idea of mental health services, I'm surprised that this $36,000 isn't viewed as a pretty good deal for the taxpayers. And to the proposal. I know this came up in discussion verbally, maybe even half a year ago, but I believe this is the first time we've sat down in a public open meeting and discussed this proposal in a public open meeting. And so I don't know what information you all may have heard or had in an email or whatever, but I've never received the information that two of the commissioners have been referring to this morning. I don't know their perspective because I've never known anything about a $9,000 proposal. I never heard that. This idea that we're going to do a 3-month checkup and do refills, I don't even know what that's talking about, but I do know this. This clinic is uniquely qualified to do mental health services if we go forward with physical needs. Now, ComCare, as far as I understand, if they have physical needs, we have to refer them to someplace else. And I say they provide mental health services, yes, but if they have an infected toe or something, you just imagine whatever other issues might happen. We don't have those services at ComCare. So this is a combining of services. We're not investing in the physical side, but I do know they provide that, and they have since 2010. So if someone comes in and has mental health services, by the way, we know that homelessness and substance abuse and mental health issues and physical needs all sometimes cross lines. And I think that to be able to provide a service that crosses over into physical needs actually is an improved service over ComCare. And if I heard correctly, when our director of ComCare spoke a moment ago, she said that this will not negatively impact ComCare. I think she just said that. We can play the tape back if we need to. But she said it does not negatively impact ComCare, and one of the commissioners says it does. I would say, actually, I think to the extent we're providing some services to the community, there is a benefit to ComCare because it's another patient that they can trust is being taken care of by someplace else that provides that service. There is a but for. I asked Abdul, why did you not start this 6 months ago? Because they're waiting essentially for us to invest in this. It is just $36,000. I mean, that again, it's a lot of money, but it's $36,000. They could do this probably without Sedgwick County, but I don't think that's the intent. The intent is to do a public-private partnership and get grant funds and get donated care. It is the proposal they come to us with. There is a but for. If we don't do this, it's not going to happen. If we do it, it will move forward. And again, it's a trial version. We're going to get data, performance measures data to find out whether it worked or did not work. It's an attempt to find out what the private sector would do if we would partner with them. To me, that's a model, maybe not just with Mayflower, but with other providers in the community, might be part of the answer to Sedgwick County's mental health crisis, is to find public-private partnerships that would provide those services even better than government can. I'm frustrated because, again, I agree with Commissioner Dennis. We talk about mental health like it's the most important thing, and it probably is the most important thing. And for those that champion mental health, I am a little bit surprised that we're actually having this debate at this point. Thank you, Chairman.
Okay. Everybody's spoken quite a bit. Commissioner Lopez wants to speak again. I've got a question to ask, but I want to speak. Is there any way that that you guys could relook at your proposal maybe make some slight revisions, some slight clarifications, resubmit for staff to review so they can bring it forward. We've had a ton of discussion. Everybody knows everybody's emotional opinions. So if we can get back to the business of your proposal, if you could just make sure it is what you're comfortable with, resubmit it to whoever you submitted originally, Tom or the manager, and then they can have staff reevaluate and reconsider themselves about what, if it fills a gap or not, and what value it could add on top of what ComCare's today doing. That would be, with all the other comments, I just wanted to get back to the business, and so, but I'll continue on with any other comments. Commissioner Lopez?
Thank you. So on July 29th, we all received this document that we're talking about. It's multiple bullets of the concern. So we all have had the opportunity and quite some time to look that over. Look, I've been asking for exactly what Pete said this whole time. I just think we need to slow it down. We need to look at this proposal a little bit more in depth by our staff, and then if they determine it's the right path, then I would love to help fund that. I am not comfortable with it until that happens. So again, I agree with what Pete just said because that's what I've been asking for. And I just think, we need to realize that yesterday we just talked about even the propriety of, just how this looks, right, to the public. And I think when we're talking about their tax-paying money, we need to make sure that we can answer to our constituents because they're going to ask about this. And I need to make sure that I'm comfortable saying, this is why we went this route. And if it takes a couple more weeks, then I think that that's exactly what we need to do. If we rush this, just even if there's nothing wrong with the proposal, right? But if we rush this today, what does that look like to people who are watching this meeting? That if we have friends, that we will help them before we help other people that have asked for money that we've turned down. So I just think it's extremely important that because of who made the original ask and whether that's, right or not, it's just the perception that's out there right now. We need to make sure we are going about this the right way, that we are crossing every T and dotting every I, and then if it comes back that this is the right decision for Sedgwick County, then I will support this and I will champion this along with anything else that we do for mental health. But until I see that, I am not comfortable with this. So when people ask me, I want to make sure that I'm comfortable giving an answer on why I supported something or why I didn't when we're spending their money. So I appreciate your comments, Pete. That's what I've been saying, and that's what I will continue saying, and I hope that we can get to a point that we can support this.
Okay, because we're not voting on anything today anyway. This is a staff meeting workshop. So, okay, Commissioner Cruz.
Thank you, Chairman. Tom, the email that you sent out on the 29th, did that request change? And if so, was there not another economic development summary done from that?
I was trying to remember when the original ask came in verbally from Abdul and Mr. O'Donnell, it was for $36,000 for a 1-year trial. Mm-hmm. There was further discussion later that if there was consternation about that amount, we could do. That's where the trial period, the 9,000 3-month discussion came up. I don't know if that made it into proposal or not. I'd have to defer to Tim on what actual written proposal we saw from Mayflower. But that's where that whole discussion began. But to answer your question, Commissioner, I don't believe anything has changed necessarily since the 29th or whenever that email was sent out with staff recommendation.
This right here, and perhaps we should print it out and hand it out, says that this would serve 30 to 40 clients per weekend. And so what I hear today is it would be 10 clients per day. Is that what I'm hearing?
Yes, initially and ramping up to 30 to 40 eventually. So if there's some miscommunication there, I'll be glad to correct that impression.
And
Maybe on week 1, I'm not going to have 30 to 40 patients. But somewhere down the line, 3-4 months later, that is the expected total.
Okay, so to not belabor all of these points, I just want to make myself clear that I want things disclosed from the very beginning. Like when you're asked about it in a public meeting, disclose them. Secondly, we have to have something written on paper. I mean, we're a government organization that has crazy reporting requirements. So to have verbal conversations, I don't think would fly. So for us to just talk about it, I don't believe that's the way we should be conducting business. Tim, did you have something you needed to say?
Commissioners, the analysis that I did was based on the original proposal from probably 6 months ago. It sounds like the proposal that they're offering now has evolved. So some of my comments and analysis were based on earlier information, which was I think at a lower level. And then Kyle did some analysis from an economic development standpoint, potentially on a more recent proposal. But it would probably be helpful if we had a clean new proposal that we could go through and review and determine, based on the new proposal, the merits of it.
Is there a way that we could print this out so that they could see this before they leave?
Yeah.
Okay. Thanks.
Okay, I don't see any other comments. Thank you for being here. It took a little longer than we had thought, but I think you heard everything you're going to hear from this. And so if you resubmit a proposal that you're comfortable with, and that we can look at it and then move it forward for a decision up, down vote. Okay? Okay. All right. Thank you. You bet. Tom? Oh,
Chairman.
Commissioner Howell, sorry.
Yeah, just a final comment. KBC Hospital came in a few years ago, and I think the commissioners supported that 5-0 pretty solidly. We actually attended their opening, but that money we committed to that actually came in after they basically already had the name on the building, and the opening was planned. We gave them $100,000 just simply to essentially, it's almost a good faith effort to support KBC Children's Mental Health Hospital. And again, I supported that as well. It was the right thing to do, but there was no but for. We gave them $100,000. That was just a couple of years ago. Thank you, Chairman.
But they also weren't under the cloud of, so you can't really compare those two.
Okay, Tom. Next item, please.
Chairman, the other item we had was to discuss the ethics policy. This discussion took a little longer than I anticipated. We're not in a hurry to discuss ethics. We would be willing to do that today. It's up to the commission whether they'd like to have that topic heard or not.
Okay. And do we have can we all make sure we have the final copy of this is the employee
Correct.
copy, so.
Yep.
What's the will? There is some distractions that I could be at, and I think Commissioner Lopez, you got last minute request as well and an email. Governor's in town for something, so we could easily delay this unless there's respecting you, Sheena. I'm respecting you. Is this critical today, or?
We can put it off when you're ready.
Okay. Well, what's the will of the commission? To delay? Okay.
Chairman, I would like to also delay, but I would like to just give you a copy of some red lines I would propose, and you guys can take this with you and read them.
Okay.
And so when we come
That's
back
fine.
together, hopefully we'll have, if you will, maybe
Okay.
a discussion that gets us to a 5-0.
Okay.
We'll bring it back next week.
Perfect. Okay. Let's do that. So make sure that we get a copy of the latest and a copy of Commissioner Howell's red line, and that if any commissioner has something that they want to share right away after review, let's make sure that we get that to Tom so we can all publicly have a copy. Okay. There we go. Okay, so we will adjourn, and we will see everybody at a commission meeting tomorrow. Thank you. Okay.
Perfect, thank you.
Hey, I'm not done working on it, that's kind of
Thank you. You're running this place. What is the name of the governor?
It's they're just